Michael, I'm excited to dive in with you. Um, I've known you for a while. We went through the same Cedar-Sinai program when I was at Home Hero, and you are now still at Stasis Labs. Why don't, for myself and people listening, just catch us up with where's Stasis today? What is it? What is the organization doing?
Yeah, absolutely. So just a quick explainer. Really the whole goal of Stasis is to bridge the information gap between how patients are doing and what nurses and doctors know. It came from a personal experience of my co-founder losing his grandfather inside of the hospital because nurses and doctors didn't know that something was wrong. And we've really built out a remote monitoring solution that is available to really any hospital around the world to be able to know in real time kind of how all their patients are doing. I've been working on it for quite a while now.
And you guys at one point had a pretty big presence in India. Is the U.S. market the focus, or India, or other places?
Yeah, great question. So we started off in India, as you said, and for us now, we're looking at different regions around the world. North America and West Europe are not as much the focus. So really focusing expansion on Asia Pacific, certain parts of Middle East and Africa, as well as quite a bit of efforts in Latin America. Really kind of more outside of the markets that have the highest health IT infrastructure is probably the best way to put it. So like those that have not invested large amounts of capital in setting up, on-prem servers in their hospitals with large IT teams and every bed wired up with Ethernet. Kind of how I like to think about it is, Africa is not laying landlines. They've just gone straight to the cell phone. And so hospitals and a lot of the rest of the world haven't invested in a lot of this legacy infrastructure. So we offer them the opportunity to kind of quote unquote skip the landline and jump straight to the smartphone with more modern connected medical technology.
That's interesting. So it's less appealing to people who have invested a lot, which would be U.S. tech companies into healthcare. Most people I talk to in healthcare, there tends to be probably more than any other industry, just a focus on U.S. market. The healthcare market is so different in country to country. In the U.S. is so huge. There's so much money in healthcare, but you're kind of with Stasis Labs. It's like you're specifically applicable or valuable when there's less infrastructure built up, which is kind of interesting. Um,
Yeah,
yeah,
from a business side, it makes sense why people target the US. If you look at pretty much all the multinationals in healthcare and you look at their P&L, 50% plus of the revenue comes from North America. So no wonder that when a startup who needs to define a target go to market, of course they're going to go after a large market. Now, that doesn't account for how competitive it is and the stronghold that a lot of large companies have and how difficult that makes to actually break into the market. It's a tough market to crack. But if you do crack it, there's a big jewel on the other side. And I think that's why a lot of people focus on it. And it's just generally, there's a more innovative mindset, I think, in US culture around that. The rest of the world historically has not had the resources or the ability to invest in a lot of this. That's been changing over the last decade with the access to internet and adoption of smartphones. And the COVID pandemic has completely accelerated it because a lot of these things that we've called nice to have, things like connectivity, patient data being on electronic medical records instead of in paper, things like that. I think health systems around the world are now realizing that it's not just a nice to have, but it's actually a need to have if they want to keep sustaining and delivering good patient care. It's been a really
yeah.
interesting switch the last couple of years.
So how are some of these hospitals? Right now, are you in South America or Africa, or is it more tentative plans?
We have different partners we're working with to break into. We are not currently serving patients in
Hmm.
Latin America. If my wishes go well, we will be before the end of this year, but we aren't yet.
Yeah,
Right now,
yeah.
we're mostly in the Asia Pacific.
Asia Pacific, India primarily. I mean, could is India a big enough market where you could just be in India and be successful?
all depends on how you define success, right? So,
Yeah. Yeah.
this actually might be an interesting conversation to dive into. We went through an accelerator. We're indoctrinated into the kind of tech startup culture. I have nothing bad to say about it at all, but it creates a certain mindset around what success looks like for a company. And I think the longer I've done this, the more I've challenged my own definition of success. To me, success is about delivering a solution to a problem for a customer and creating a sustainable business out of it. So to me, I'd rather raise less, get to profitability sooner, and ensure that what I'm doing for my customers and partners stays alive and I'm not relying on my next fundraise in 12 to 24 months from now. So to me, success is more getting there than growth at all costs. So in terms of success of building a sustainable business, yeah, for sure, India can sustain that. Now, I obviously want to grow from that. And that's where having a larger market is important. And I think that's also where your average selling price can go up. And India is pretty low, even if you look at the global stage. So by leaving India, it allows us to be able to generate more revenue on average per customer. And that really gives us the margin we need to be investing in new product development efforts to really expand what we're doing. So I think leaving India is important to meet the customer requirements that we really want to meet. But I don't view it as much from a revenue growth story the way like a venture investor might view it.
Yeah, that's interesting. I was talking to somebody recently who was describing this illusion of market size, and he was talking about India, and he said there's I think 1.3 or 1.4 billion people in India, but the number of people who have bank accounts is like on the I could be wrong on this, but if I remember correctly, he said on the order of 80 to 100 million. So it's if you consider that versus the US 380 million people, I would guess, 50 to 80% or so of the adults are banked. So the percentage of the people who have the ability to put a credit card down, lay a payment down, you look at 1.4 billion people and you just think that's an enormous market size. And I do think there's got to be an elevation in the purchasing power, per capita GDP over 10 to 15 years, but it's still kind of a ways away.
Totally.
Yeah.
I mean, at the same time, though, I know the whole China-U.S. relations is a hot topic right now, but I have to at least mention it. I mean, 20, 30 years ago, China wasn't even one of the top GDPs. It wasn't even on the map as one of the top 20. And now they're really putting the U.S. for a run of its money. It's come up out of the middle of nowhere. And,
Yeah.
this might be an unpopular opinion, but I'm very bullish on India. As you said, there are 1.3 or 1.4 billion of them. And I bet that because of a lot of the things that are happening with the rapid expansion in the middle class and what that has created in terms of, going from very basic necessities like basic infrastructure of housing and food into, more buying things you want and being able to travel and going to entertainment. That's becoming something that a lot of the country is able to afford. And they have an incredible work ethic and they're really, really sharp people. And so I think on a global stage, people are really underestimating what India is going to be over the next 50 years.
Yeah. Yeah. Well, 50 years is so long, it's like, it's hard to think even past, 5, 10 years if you're making like, if you think about a company, how long does the company's run? Maybe 5 to 7, 10 years at best. Realistic, like the founder start to finish. And then investors, I think, aside from like long-term institutional investors that are putting down money for endowments, the average VC is thinking like 3 to 5 year returns, maybe 7 years. But so, yeah, but you're right. I think undeniably that is the shift that is going to happen.
Yeah.
What are other things you and I talked about a year ago, I think at this point. What are other things that have come up? You guys, I guess, let me describe first. You have the device. So I don't know if it's behind you or if that would be.
Right there.
Oh, awesome. Awesome.
Yeah.
Yeah. So the device sits next to the bed, monitors the patient's vitals, and then communicates that via API to anyone who needs it. Is that the general concept? And has there been an evolution of the hardware?
Yeah. General concept is correct. Essentially the idea was measure different vital signs at the bedside, and then make that available to the nurse and doctor wherever they are. Right. So we essentially set up like dashboards that show the real time status of those patients, and we'll put them at nursing stations. We'll set up rapid response teams. We'll put them in the pocket of the doctor as they're on the go, within the facility or anywhere. And then, start adding in other things, an analytics layer, collaboration of how nurses and doctors can communicate with each other to be able to handle if something's going wrong with a patient and what to do about it. So, now that we've monitored over 60,000 patients. We have thousands of users that are using us each month. Now it's really about what are other problems that people are facing in delivering real-time care that we can start kind of chipping away at now that we have the presence both at the bedside as well as nurses and doctors are using our solution.
Yeah. Any other things that have come across your plate, or you feel? I haven't tuned into healthcare nearly as much in the last few years. Give me a quick recap. Has there been massive changes, both maybe specifically in your subdomain of healthcare or more broadly in healthcare across the US, or anything that comes to mind?
Yeah. Well, the COVID pandemic happened, right? So,
Oh, wow. Yeah, that's right. Forgot about that.
yeah, I mean, the whole healthcare industry,
So,
globally speaking, has completely taken a bit of a shift.
yeah, I would imagine a growth overall, probably serious growth in healthcare. And then I would imagine there's been an acceleration of telecommunication services that are both developed and then approved and funded. Uh, I'm sure you could rattle off the regulatory barriers that were in place that then dissolved when everyone said we can't go near any other human being. So obviously, Zoom and video communication become a default pathway to care. Are there any other, I suppose, non-obvious implications that you've seen?
Yeah, it's a good question. One comment I would say on the telecommunication side before I answer that is, regulatory and billing and all that has definitely been an obstacle. But, I think when I look at a lot of what's happened, there was this huge hype cycle, right? Like right at the beginning when COVID happened, the March to June timeframe, we see this like insane spike in telemedicine visits. And then that kind of has been tapering off. And I think there was a lot of hype that was created around it. And I share all of this because I think this is actually a comment that's applicable to a lot of areas of healthcare innovation. There's this huge hype cycle around it, and I think it's leveled off. And if you look at public companies and private companies alike, they made this huge bet on like, wow, we're really in this new normal. Like virtual care is going to become the default. And I think what people often forget is healthcare is about caring for people. It's all about people. Technology just helps augment and do jobs easier, better, faster, more informed. But at the end of the day, healthcare is a people-to-people thing. I mean, look at Home Hero, right? That was your entire business. And so, I think when I think about a lot of the trends that have happened, remote patient monitoring, which is the space that we're in, most people didn't know what that meant. And now, like, I feel like the average layman that I meet knows what RPM is. But I think that people often overhype or over rely on technology as a solution to healthcare problems, whether it's getting people better, it's reducing prices, it's anything like that. And technology absolutely has a role. There's not a question. That's why I'm in it. But I think people heavily overemphasize how technology can be a solution. It's really technology can help people solve a lot of people and process problems. They're not usually technology problems. And I think
Yeah.
and for me, and if I look at a lot of what's happened in the last 2 years, is there's been a lot of examples where I think that's really been highlighted. And I think ultimately it has allowed the entire healthcare industry to mature in the way that it views and approaches innovation. But it doesn't go without its growing pains.
Yeah, yeah. I tend to think that there's a reason for that. Technology certainly technology in the software space. Like if you're purely selling software for business purposes, enterprise purposes, consumer purposes, social media, hardware, all that makes perfect sense because the technology is the product in and of itself. Whereas technology in healthcare is a pathway to what you want, which is reduced physical, mental suffering, increased physical capability to move around better. That's ultimately the product that people want. And then there's problems they identify with symptoms, head to toe and inside and outside. And then there's solutions, which, like you said, are primarily a person serviced level solution, facilitated through or improved by technology. I tend to feel that healthcare has a lopsided perspective in the West where we look at people as machines, either overtly or subconsciously, saying that whatever the problem is, Michael, you've got this, your ADHD or some mental diagnosis, slow to learn, speech pathology, internal gut issues, whatever the issue, pick a part of the body and there's something wrong with it. We can tweak that. We can introduce a chemical compound, a pill, and that is, I think largely the perspective of Western medicine would say, we know it's not perfect, but science is on the way there. We don't have the perfect drug, but we're investing billions and billions of dollars. And introduce the concept of vaccines. It's like, it slots right in line with that. And I tend to feel there's this giant missing piece, which is the perspective of the ecosystem. Like if you look at human beings as robots and take us apart, there's all these little parts and they really exist, but then they also interact with each other in these crazy complicated ways. In particular, the hormonal system, endocrine system, mental health, and the connection of mind body, the impact of nutrition and food and diet on every part of your body. I think these are things that are like starting to become more and more introduced into the zeitgeist, through podcasting and just some pretty popular doctors that are putting out ideas that I think are really resonating with people, and not even necessarily doctors, nutritionists. And I think that's so important that continue to grow. It does sort of introduce a conflict on some level because of the traditional incumbents in the space that are making billions of dollars. I think roughly 18% of our GDP is in healthcare. And that is like those entities, the people who run those companies, they don't want that to shrink. So if you could buy a vaccine that costs hundreds of dollars, get a pill that costs hundreds of dollars, that's way more money than it would be to just change your diet. And I think the shift that has to happen, like we either become sicker as a society or we become healthier. And the healthier path is like, how do you scale healthy food production? How do you eliminate pesticides and all of these dangerous ingredients from monocrop food agriculture? It seems like do you agree that that's becoming more like pervasive in the awareness of people within the medical field, that attitude?
Yeah, I mean, for sure. I think you brought up a lot of great points there, and God, there's so many different directions I could go with this one. I mean,
I know. I threw a lot at you.
there's a few quick thoughts that come to mind. I mean, first off, everyone in U.S. healthcare talks about this concept of value-based care. Um, I'm all for it. I think it's the future, and it resolves a lot of the problems we're talking about. But if you actually look at the billings that are happening in most healthcare systems, we're still mostly fee for service. And just for anyone listening who doesn't know what that means, fee for service is essentially you bill every line item of everything you're doing. Value based care says, hey, you have a problem. We've, assessed and see on average it will cost $25,000 to solve that problem. So we're going to give it to you. And if you solve it for less, you make more margin. If you solve it for, if it takes you more, you're going to lose money. And that I think aligns incentives much more, but it's unfortunately not the model that the majority of U.S. healthcare is delivered on. So I think that's definitely a challenge, and the incumbents of the space don't want fee for service to go away. It's amazing; you can make a buttload of money that way.
Yeah.
I think going back to the comment around COVID and what's happened over the last few years in healthcare, one of the most tragic parts of COVID, but the silver lining of it is the mental health issue, right? I mean, we isolate people for a couple of years and we've seen mental health issues go up, drug abuse goes up, all suicide, all these different problems goes up. But mental health has been such a taboo, stigmatized topic globally. And I think it's going to take a while, but I think over the next decade or so, that this has opened up a Pandora's box where we're going to see that we can't avoid it anymore. It's such a big driver of what we do. And I would actually go so far as to argue, and I'm sure there's no accurate measurement of this, more time is lost from work and productive hours because of mental health issues than physical health issues. I would bet
Yeah.
how you measure that one. But if you start really going to the source of what you were saying, a lot of Western medicine is about treating the symptom rather than treating the core problem. It's reactive versus proactive, or even in proactive, you can go far as preventative. Things like adjusting lifestyle with better diet, with better managing your stressors, with exercise, with meditation. Those have far lasting positive impacts on anything that's going to happen down the road with physical health. But it's hard because how do you measure that? And how do you make money off of that? And people don't value that as high until they start facing problems. We're kind of funny. It's like we don't want to pay $100 to go see a therapist, but we'll pay 10,000 when we need a surgery on our foot. It's
Yeah.
so I think that
Yeah.
there's a
Yeah.
bit of a mental perception. Not only is it the way incentive structures and billing and everything is lined up. I think we as human beings even get get in the way of this as well. Our value perception is different until we see a real problem presenting ourselves.
Yeah, I resonate with a lot of what you just said. Adding on to it, it seems to me that the crucial structural alignment of incentives to get right is how the payment of the actual care, who originates the decision on the payment of care. So if I go into a doctor's office and everything is paid for free, meaning that it comes from the government, meaning that we all chip in taxpayer dollars, then the decision on what gets paid for is made by people in offices in Washington, D.C. It's a government dictated healthcare direction, and that's the shackles in my view. That shackle is it's like you can't get out of that. It's like a jail cell, because if you wanted to, I mean, you could. I take it back. You could get out of it. You could just elect to pay your own path if there's a service that you want that's not offered by that market. But unfortunately, other people are going to go through that path, and whether or not it's effective is there's not a good checks and balances. And this is if I go to one, if I could just get one idea in healthcare that I wish would resonate more with people, would be the removal of the employer mandate for health insurance. It seems to me, everyone I talk to is like, yeah, that seems like the left and the right, like bipartisan support would support that, where you remove the requirement that employers pay for healthcare. And alternatively, you could say, yeah, they could offer health insurance, they could offer car insurance, they could offer flood insurance for your house, but they don't typically offer flood insurance for your house as a benefit when you join like a tech company, but they offer health insurance. And if you detach that, if you allow the decoupling, where you're like, Michael, come work for Google, instead of taking 16% of your pay and then giving you health insurance, I'm just going to give you 16%. Like, you want that 16% bonus, go for it, and then you buy your own health insurance, and you can buy it from anywhere you want. And that would allow more competitive free market insurance companies with the assumption that they can offer different types of services. And I think eventually you stop spending 16% of your income on insurance. Maybe you spend like 5%, and then you buy healthier food. And you end up, I think it's like the forces that I think you're referring to, and I think of as, is the corporations in healthcare versus the mass of people. The mass of people want better health. The corporations want to make money. And that's not to imply that that's evil or some kind of malicious attitude. It's like they make money by selling goods and services that people want, presumably. But I view the detachment of the employers would just allow this flourishing of individual incentive for healthcare. Like I don't ever want to interact with the healthcare system. Like I would just hate to have to walk in and be prescribed some pill. It just feels like the wrong pathway. Um, yeah,
I don't think many people like to interface with the healthcare system, so you're
yeah,
definitely
that's
not
true.
on that one. Yeah, man, no, I completely agree. And I mean, I think a lot of what you're talking about, fortunately, is a trend that's happening, right? I mean,
Mm,
I think most people in healthcare talk about this as like the consumerization of healthcare.
yeah,
You may have heard that, and you see it, right? You see Forward, One Medical, Carbon Health, all these like PCP subscription services coming in, and urgent care, trying to privatize those things. And I think there's a few interesting pieces to that. On one hand, by putting the power of the decision maker into the end patient, it actually moves the patient back into the center of the equation. If you look at the
yeah,
current healthcare system, like if you look at all the different stakeholders, it's kind of feels like the patient is just like way out on the end there.
yeah,
Like like everyone talks about patient safety, but I feel like when you actually look at the actions of where money's being invested, where policy change happens, all that, it kind of just feels like it's to squeeze out more money. And you look at medical inflation. There's a reason why in the U.S. 18% of GDP is spent on healthcare. And note, there's only like 4 countries in the world that entire country's GDP is even that amount of money. Like we're spending more money on healthcare than almost every country GDP in this world.
God,
And I think part of that is if you go into the hospital and you see a Band-Aid or an aspirin's like a few $100. Well, if the patient was end up paying for that, I can guarantee you that Band-Aid's not going to be a few $100, right?
mm-hmm,
It's because there's all these middlemen that are trying to grease their wheels and make money out of it, and they know the insurance is going to pick it up. So who cares?
mm-hmm. Yeah,
Um,
yeah, and the insurance company doesn't really care because most insurance companies make money as a percentage of the premium they charge employers. So
yep.
if an insurance company like Blue Cross Blue Shield goes to Google and says, "Hey, we'll give you this deal on all your employees," like we're going to take a 4% fee on everything that gets billed. So obviously, Blue Cross Blue Shield wants that to go up. Like to have insurance companies have customers and employers means that the insurance company wants the Band-Aid to be $300, not $200.
Exactly. Yeah, the incentives are all not in the favor ultimately of the end patient. And more importantly than that, even, the model that we're describing here is completely unsustainable. Like, it's just continuing to go up. And if you look at the rise in costs in US healthcare, even over the last 20 years, they're going up at record high rates. So, like, this entire system is not very sustainable and just needs to be, I think, rethought. And to bring back the conversation to the beginning here, you were saying, hey, most people start in the U.S. I have nothing bad to say about U.S. healthcare. I grew up in the U.S. healthcare system. Most of my family works in the U.S. healthcare system, and it's inspired me to do a lot of what I do. But I think for me, when I invest my time and energy in building a company, which, as you know, is just a really hard no matter what you do, I'd rather know that my blood, sweat, and tears are going to support patients that have largely been overlooked and whose healthcare systems are much less developed, because it feels like I can have a much larger impact and actually shaping that healthcare system the way that I wish the US healthcare system was. And a lot of these healthcare systems are still in a more basic format that I feel like they can learn a lot from what the West has done wrong and do it better out the gate. And that's kind of how I view about our role on the technology side, is where did health systems in the US screw up with IT, and how can we be a small part of making that better, learning from their mistakes.
Yeah, and I feel like it naturally comes full circle where the only way to convince people I should say the best way to convince people to change is by providing examples of other people who are doing what you're trying to convince them that is better. And so if I were in office and I was listening to some lobbyist, some healthcare lobbyist, explain some change that he wanted to the governmental regulations around healthcare, I'm going to ask, is this being done anywhere else in the world? Are there examples of this that are working successfully? Do you have any data to support this, any research studies? And if you can go in other countries, like you as in Stasis Labs, and show that, hey, we're in 100 hospitals in Africa, Latin America, and India, and these are the results by taking this approach, then it just increases the momentum, the counterforce to like this hyper consolidated healthcare market we have in the U.S., which I think is a great thing. Like if you're going to make an impact domestically, ironically, it may actually be best to make an impact abroad in other countries first, then use that as examples.
Totally. No, I think that's a great point. I like to kind of, when I'm talking to clients and partners about this, I like to describe it as leapfrogging. Like you have this opportunity to actually leapfrog, and I think a lot of people in the rest of the world get really excited by that, right? Like they're like, we want to be a healthcare provider that people view as even more advanced and better than the average U.S. hospital. Like they're not just going for getting up to on par. Like they
Hmm.
almost view it as like, yeah, they've done a lot of great things, and right now they are doing better than us, but we have an opportunity to leapfrog them and actually be better. And I think that's what a lot of them are striving for. And
Yeah.
that gets me excited. It's fun to work with them.
Yeah. Yeah, it is. It matters so much. There's so much meaning behind it because it's such a huge market, you know. And there's so much. I find it exciting that it's so jazzed up politically because it crosses across like certainly the financial component to it. It's the largest market. Then there's the moral issues of like, okay, what if someone doesn't have insurance? What are you going to do if they break their leg and they go into a hospital? And you have to be able to answer those questions. So it's not, it's so interesting in that way where it's solvable, but you have to be smart about like there's a clear role that government plays. I think
Yeah.
I certainly don't want to come across as advocating that the solution is to remove all government because it is I don't like the buzzwords around like moral right, but it's something that we collectively want at least emergency care for people to have access to, regardless of their social status. We're at that point in society, and I think that's the energy behind like the Bernie Sanders Medicare for All movement is like they ultimately I think are alluding to the concern for people who don't have the ability financially to purchase usually catastrophic urgent care for the most part. I don't think anyone's fighting for, you know, people that are on the impoverished level to have like plastic surgery for aesthetic purposes. It's really for, you know, these heartfelt examples are like, oh, I had cancer and couldn't afford treatment. And there's that rub. It's like, okay, how do you factor in the financial and the healthcare well-being?
Totally. Yeah, and there's always a balance here, and I completely agree with you. I would not advocate to the government running everything, and I wouldn't advocate to the government not being involved. I think it's about finding, you know, private-public partnerships where each one is playing to their strengths. I mean, I think the reality is the government is not great at delivering most services in a efficient, high-quality, cost-effective way. The private industries are usually better at a lot of the execution of things. But the public is great when it comes to policy, when it comes to funding, when it comes to some of those things. So I think that, you know, the reality is that every human being in the world is going to have to interface with healthcare. We all die. We all have healthcare problems. So no one can avoid it, whether we like it
Wait,
or not.
do you ever see the do you ever see the Office? You ever see the movie? Not the movie, the show The Office, where
Yeah.
Dwight Schrute is being interviewed, and I forget what the context was, but he's like in the wild there is no healthcare. If you get eaten by a bear, you just die. It's just out in the wild there is no healthcare. It's good to
Great.
kind of take that perspective sometimes. It's like, look, it's not a moral right. I mean, we built these systems, we train these people, we developed this knowledge. We're not, you know, humans aren't like planted on Earth with a hospital right there. It's like, oh, this is your right. You know, it's we're fortunate to have this amazing technology and these people and the knowledge. Like, you can't force people to provide care. You know, you just it's
No.
it's a bad pathway.
Yeah. But, you know, as you were saying before, I mean, I personally do fundamentally believe that every human being, regardless of, you know, where they were born and who they were raised by, deserves basic access to healthcare. The same way that I believe everyone deserves basic access to things like food and housing
Hmm.
and education. Like there's just certain like basic things that I would define as a human right there. So I think there's always about trying to kind of find that balance. And I think a lot of where I see the problem comes up is not like, do we believe that to be true? I mean, I feel like, from the left to the right to the
Yeah, agreed. Agreed.
like everyone agrees that concept, right? It's just how do you do it? The how
Right.
is, I think, always where people get tripped up on, and there's kind of this moral side, but then you need an economically sustainable way of doing it, and how do you kind of balance those two out, and where do you draw that line of what is enough?
Mm.
I mean, we're definitely not going to solve it here. It's a very complicated
No, I think we
topic.
figured it out. That's just about a wrap there. Uh, what's next for you guys? Are you guys looking at the pathway towards profitability and just grinding on sales and organic growth, or yeah?
Uh, Yeah, I mean, my like single biggest focus right now is I just want to expand the impact that we are making on patients to different countries. So just a big focus internationally, expanding to
Mhm.
new places, finding partners to help accelerate that, and a big push moving more and more in the direction of software. It's not yet announced, so I can't quite talk about it, but I'll share it when it is. But we're doing a big push to move more and more into the software side to help us kind of scale our impact faster than we could today.
It's awesome. Awesome. Well, keep us in the news. And congrats on all the progress, Michael. I love what you guys are working on, and yeah, keep kicking butt. Keep doing your
Thank you,
thing.
man. Yeah, no, always a pleasure to connect with you, and yeah, look forward to
Oh,
catching up again soon.
last thing I want to ask you: are you writing or tweeting, or do you want to throw out any accounts or uh, blogs or anything?
Yeah, no, not really. Actually, I'm
Hmm.
not super active on any social channels. Probably LinkedIn and Twitter is where I do the most, but no, actually, I haven't been too active recently.
Cool. Good for you.
Been super just hands down focused on building the business. To be honest with you,
Yeah. Good.
it's been a
Good.
whirlwind.
Keep doing that. All right, my man. We'll chat soon. Take
All
care.
right, take care, man.